Hey guys, it's Laura at Front Office Rocks again, and I have another video topic, which is offering second opinions and consultations. I'm working outside today, so not a bad outside office. So I wanted to take a couple minutes because I had a client actually who asked me my opinion on free second opinions and consultations. And I have a pretty strong opinion on that. So I thought, well, why not answer it in a video for the client and for you guys? So remember, my background is general dentistry. So I'm going to speak specific to general dentistry. I do have some opinions on specialty practices, but my focus really, or my experience, is on general dentistry. And the one thing that I will say is with all of these videos, this is just my opinion. I'm not saying that this is fact or you have to apply it in your office. This is just suggestions, ideas, and opinions that I have. So my opinion on offering a second opinion and free consultations is yes, 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 yes. The reason is patients, when they're calling your office and they're looking for a second opinion, or they have an emergency, or they know they need an implant, they have a missing tooth, whatever. First of all, you can't diagnose them over the phone. Somebody might think they need an implant, and until they come in, we don't know if they need an implant or not. So I can't diagnose over the phone. If they're shopping around because they've been diagnosed by another dentist, one of my things to say is, just because one dentist would do a certain treatment to a tooth for a patient, another dentist wouldn't potentially do the same thing. So until our dentist sees you, we can't tell you whether or not you need whatever the other dentist is. So we really need to get you in the office to find out what you need. So that's my first thing. The second thing is to understand that we really can't sell you over the phone. And I know selling is a negative term, but think about what we do for a living. We put drills and needles in patients' mouths. So it's not like they're gonna go, yay, I really want that. So when we are talking to our patients about what they need and about dentistry, we're talking about thousands of dollars sometimes and drills and needles in their mouths. Nobody's gonna go, oh my gosh, that sounds great, can I schedule tomorrow? We need to do this face to face and respect the patient, and I don't wanna do that over the phone. I wanna get them in and talk to them. It's a human, it's a person. I wanna see what's really going on with their tooth. I really wanna get a diagnosis for the patient, and then I wanna have a real conversation with them, which has to do with case acceptance, and we'll talk about that later in other videos, and we have a ton on Front Office Rocks. But I can't do that over the phone. I really, really can't. Now, I know that there are some offices and some doctors who might be saying, yeah, but what if we do an x-ray? But yeah, what if they need an exam? What if they need something bigger than what they're coming in for? Then handle that when they're in the office. Bring them in, find out what's going on. If you need to do something in addition, or you need to bring them back for a new patient appointment, or you need a bigger consultation, great. Then schedule that with the patient and talk to them about it. But don't do it all over the phone. One of the biggest things I think we do is we put up too many barriers on the phone. So if you're trying to make money by charging a consultation fee, and again, I'm talking about general dentistry, but if you're trying to make money for a consultation fee, or make money for spending 15 minutes with a patient, it's not worth the money and the loss of the patient. I would rather get the patient in and have a conversation with them, find out what they have going on. Don't schedule an hour because you have no idea anything about this patient, they're brand new, but schedule enough time to get them in, find out what they have going on, see if you can put together a treatment plan that we can present to them to talk to them about, or if it's a bigger case, do we need to bring them back for x-rays and FMX, for an exam, whatever your policies are. But don't set it up so much as a barrier on the front end where you have to pay for this, this, and this, and this, because patients are probably not going to come to you. Ultimately, our goal on the phones is to get the patients to show up and to do whatever it is you need to do. So I'm a huge fan of free second opinions and consultations. Now, second opinions specifically, one of the reasons that I love them is that second opinions are patients that have already been to another dentist and they know they need something. So they're already one step ahead of patients who are just coming in for a cleaning as a new patient. These patients know they need something, but for some reason or another, the other dentist didn't convince them to get it done there. They didn't present it in a way the patient was on board, whatever the case may be. So that patient, we need to get them in to basically sell them on us, right? To get them to understand we're the best dentist in town for them, and this is why you need to get the treatment done here. So I love it when people already know they need something. Maybe the treatment plan's not going to be exactly the same as the last dentist, but that's why we want to get them in. But I would rather have the patient come in and let's build rapport with them. Let's make them a new patient of ours. Let's wow them. Let's treatment plan them with what they need. And then they can become a patient of ours. We can get the treatment done. But don't try to do that all over the phone, because you're going to lose a lot of opportunity to get new patients in the door. So that's my 2 cents on second opinions and consultations. I do think that specialists, in most cases, I can see why you charge a consultation fee, because all of your patients are coming in that way. I've never worked in a specialty office, so I'm not going to even try to say I know the right answer to this. I will say, though, that I think that for your top referring general dentists, coming up with a way to give them an offer for their patients to get a free second opinion or consultation, like maybe have a limited number of them, have your favorite dentist that send you the best patients, their patients don't have to pay a consultation, or they can give a certain number of cards out per month for people to come over for consultations. Because you want to give some sort of a thank you, of a way to get the great patients from the great general dentist office. So that would be one of my things. Again, I'm not professing to be a specialist, trainer, but I am thinking that would be a good suggestion. So anyway, tell me what your thoughts are. Write comments below. Subscribe to this channel. Again, train your team members on the phone. This is a training thing. Shoppers, how do you handle shoppers? How do you handle people that just want to know the fee? We have to train our team how to handle those. But in the meantime, come up with a policy that works for your practice about second opinions and consultations. If you like my opinion, great, try it. If you don't, at least you listened and you gave it a thought. But in my opinion, that's my opinion. And I thank you guys for sending questions in, and I will keep answering them as they come in, as long as you keep writing them and subscribing. And please share this channel and follow me on other platforms, Facebook and Instagram and all that fun stuff. So thanks, guys. Hope you enjoyed our outdoor office meeting today.